I'm not sure if we can hear Carlene. Looks like accessing through her web viewer. Carlene works for AFP, part of Columbia Medical Associates. Carolyn, are you there? It looks like maybe Carolyn needs to put in her PIN. Carolyn is joining us from one of the Yakima Valley Farm Workers locations. She works at Riverstone. JC, how about you? Do you want to introduce yourself?
Yes, can you hear me?
Yeah.
Okay, hi everyone, I'm JC Fitzpatrick and I am new with STC and I'm a training specialist and I will just be listening in to Rhonda's presentation and hopefully we'll be able to do these on my own soon.
Wonderful. And then looks like Julie is participating as a web viewer. Julie, are you able to introduce yourself?
Yes, can you hear me?
Yes, excellent.
So yeah, I'm Julie Christensen and I'm with Providence Family Medicine Residency.
Wonderful, welcome. Patty, you're up next. Oh, Patty, we can't hear you. I'm not sure what's happened. Looks like you need to put your PIN in or something.
Can you hear me now?
Yes, great.
Okay. This is Patty Peter, and I'm from Spokane Regional Health District, working with Becky Lynn and Danette.
Yay.
Yay.
Okay, I'm going to skip over Rhonda because she'll be introducing herself in a minute. But what about Ronna Lee? Ronna, did you get your PIN? Okay, so Ronna is a nurse practitioner joining us today from Country Homes Nurse Practitioners. And who's on the call with us from the Kids Clinic? Is that Amanda?
Can you hear us? It's Amanda and Karen.
Hi, guys.
Hello. Hello.
Welcome. We're glad to have you here.
Muted. Unmuted.
And then I can't tell if it looks like Ashley. Did you come on board?
Yes, this is Ashley Barrett with Columbia Medical Associates and Family Health Center.
Wonderful. Welcome. We're glad to have you here with us.
Thank you.
So let's have Danette do a little self-introduction, and then we'll be ready to turn the floor over to Rhonda.
Hi, everybody. This is Danette from Spokane Regional Health District. I'm here listening in as well and kind of manning the chat box. If you have any questions, feel free to type them in, or we'll offer kind of a Q&A session at the end like we have on the previous calls. So now I'm going to turn it over to Rhonda Hurst, who's going to go through today's presentation about best practices for vaccine management.
Great, guys. Can everybody hear me?
Yep.
Okay. Okay, good. All right, great, guys. Welcome, everybody. Thank you all for joining us today. So today we are going to go over the best practices for vaccine management. And this is going to be more geared towards VFC vaccines, but in truth, I mean all vaccines. When it comes to good fridge management and, you know, lot accountability and patient accountability, this really should apply to all vaccines. But today we are going to go through just kind of the best practices for those. I know some of you may have had a site visit, a VFC site visit this year, and if you didn't have one this year, guess what? You'll probably get one next year. So this is good for everybody to know. And again, during the presentation, I'll try to stop for questions, and feel free to just type in the chat box if you have anything that you would like me to bring up, and I'll try to cover everything in a good amount of time, and that way we'll have it open for questions for the last little bit of the time today. So getting started, first things first, it's a good idea whenever the patient comes into your clinic, it's a good idea to check their forecast either while they're standing in front of you or before they even come in. I know that some clinics check it. They'll go through the schedule for the next day and they will look at the forecast and print that off for the patients for the next day. That's a good way to do it. Or if you have the ability, whenever the patient is standing right in front of you, then you can go check their forecast. So this does two things. It tells you what they are due for, you know, what they need that day, and it tells you, it can also help you to schedule things out as well. So if they say, or if you tell them, well, you're going to need 4 vaccines today, we can either do all of those today or we can split them up accordingly if some of them are not compatible with each other. So it's a good idea to just check that and give yourself plenty of time to check that before the patient is right there in the room. So that's the first thing, kind of the first line of defense for getting everybody, because that's really what we're here for, is we want everybody to get vaccinated appropriately and we want them to be up to date on their immunization schedule. And then another thing that is really important is to verify and record the VFC status at every single visit. So this is newer this year. I mean, you were supposed to be recording it at every single visit prior to now, but they've made it a little more strict now to where you should be able to look back at any previous visit that they've had and say, okay, so this visit they are Medicaid. 2 visits ago they were uninsured. 3 visits ago they were privately insured, and etc. So you should be able to have that VFC status recorded for each and every visit that they've come in individually and not just write over the old information. And something that I suggest, that everybody should know these 5 VFC status categories off the top of your head if that's possible. I know that they're listed in most of your medical record systems, but it's a good idea to just know them off the top of your head. So the way I do it, I just assign, there's 5 of them. I have 5 fingers. I just assign one to every one of my fingers. My pinky is Medicaid. My ring finger is uninsured. My middle finger is underinsured, and etc. So it's a good idea to know those by heart if you can, because they are just so important for each and every single visit. And one other thing, Becky and Danette, you guys can feel free to jump in at any time if I'm missing something or if I'm off course with anything. So feel free to jump in any time if you would like.
Okay, thanks.
So when it comes to storage and handling for the vaccines themselves, this is a great little image that I found. And this gives you your refrigerators and your freezers and combo units as well. So we'll just kind of go over each one of these little areas here. So obviously, no food or beverages in the refrigerator. Your vaccine fridges and freezers are primarily and only for vaccines. Diluent can be put in there, but it's only for vaccines. No food, no you know, juice drinks, no Odwalla beverages or anything like that. Just vaccines go in there. Now, it is a good idea to have in your refrigerator, have some waters, some bottled water. And you want those to be in the doors, on the bottom, anywhere where you're not allowed to put vaccine anyway. It's a good idea to put waters there. So you don't want to put vaccine on the bottom, and you don't want to put vaccine right by wherever the air vent is. You just want to make a nice little barrier that separates your vaccine from any opportunities for the temperature to be a little bit squirrely. So right by the air vents, it's going to be really cold 1 minute whenever they turn on, and then maybe a little bit warmer later. And so you want to avoid the vaccines being too close. And on the bottom of the fridge also, it can be a little bit warmer down there because it's usually by all of the machinery that runs the fridge. So it's a good idea just to not have the vaccine down there as well, and you're not allowed to put it down there. And also the same goes with drawers. If there are any crisper drawers in your fridges, don't put the vaccine in there as well. So water is a good idea, and it helps to stabilize the temperature. So if you've ever had your freezer worked on, I've had my freezer worked on at home. They came and they said, well, it's good. Your freezer is stuffed full. So if there ever was a power outage or something happened, and this is for my personal freezer, they said having it stuffed full, there's more items in there that will maintain the temperature because air loses the temperature very fast. And if there's solid items in there, they maintain the temperature longer. So that's the reason why you want to have the waters in there. And the same goes for frozen ice packs for your freezer. It's a good idea to have ice packs in there because they will help to maintain the temperature longer. Also, you want to aim for 40 degrees for your refrigerator. That's your goal. That's just a good medium point for your fridge. And you want it to be within 35 degrees to 46 degrees Fahrenheit. So no warmer than that and no colder than that. And for the freezer, you want to aim for 0 degrees. Any questions on this graphic here? And we can look in the chat boxes and see if anybody has put anything in there. Feel free to type your questions in. And also you'll want to keep the vaccines away from the sides of the fridge and freezer as well because of the same reason. The temperature is not quite as stable as it would be in the middle. And you want your vaccines to be, you want the air to be able to travel all the way around your vaccines so that they're evenly cooled. All right, so if there's no questions on this, then I'll go ahead and move on. I'll give just a second just in case anybody has anything last minute. And one more thing, you do want to have your sticker, do not unplug sticker right there on top of the outlet. And you also want to have one on the circuit breaker itself. And it's a good idea to label it with which circuit breaker, which number it is. And that way anybody, any maintenance guys, any painters, anybody at all who would go in there and want to flip off the circuit breaker for any kind of maintenance, they can see that there's expensive vaccine in there and not to turn it off. And that is required, as well as the sticker above the outlets as well, because you don't want anybody to walk in and just unplug it. All right, we'll go ahead and move on. So, this was supposed to have a little graphic here. It was supposed to not be circled, but dorm fridges. So there are individual fridges where it's just the refrigerator, and then there's just the freezer, and then there's the combination units that are like your household refrigerators that have both of them together with a separate door. So if it is together, if it is one of those mini fridges like the dorm style, and it has a little space that is a freezer that is contained in that door, that is considered a dorm fridge, where they're both together and it's one door that opens both of them. So dorm fridges are not allowed under any circumstances. It's not that they're not recommended. It's not just a bad idea. It's just not allowed. Not allowed under any circumstances. So if any of you do happen to have one of the dorm fridges that has a little freezer inside it, call Becky and Danette immediately, and you'll want to get that removed, and you'll want to get a different refrigerator. So temperature logs, I'm sure you guys probably recognize this log here. This is what you will generally be sending in month by month. And you're required to check your temperatures 2 times every day. Oftentimes people do it in the morning whenever they come in, and then they do it in the afternoon before they leave. But be sure that you do it 2 times every day and record the temperature. And it's also a good idea to do the temperature outside as well, so the temperature of your clinic, so outside of the refrigerator, and then inside of the refrigerator as well. That just helps to have that extra information there. If you do find an excursion, if it's too warm or if it's too cold, then you'll want to notify Spokane Regional Health District immediately within 24 hours of that excursion, and then you'll want to document what actions you took. And again, as we went over on that last slide, you'll want to aim for 40 degrees for the fridge and aim for 0 for the freezer. Those are just those are like the bullseye. You can be outside a little bit because you can be between 35 and 46, but aim for that bullseye, 40 degrees or 0 degrees. As far as your thermometers go for your refrigerators and freezers, you'll want to put your thermometer, I'll go back up to this one, you'll want to put your thermometer, it shows it here right there in the middle, and that's a good place to put it, because if you put your thermometer on the side of the fridge, I've seen them screwed to the bottom of the fridge sometimes, or shoved in the back. That's not a good idea to put them there because of the same reason that you don't want to put the vaccines there. The temperatures in those locations can be a little bit less accurate, I suppose, for the refrigerator. You want to have it in a central location. Just pretend like it's some of your vaccine. Place it in the same place that you would place your vaccine, and make sure that it that the air can get to it so that it can take an accurate reading of that temperature. So the thermometers, yes, go ahead.
Hi, this is Danette, the Health District. So typically most of our providers can have a digital thermometer that has a probe and glycol at the end, and typically we put that probe in the middle of the fridge or freezer, and then you put the digital read that you're going to check those temps on the outside of the fridge. So you don't have to open that fridge just to check the temp. You just look on the outside. So it looks a little bit different than that visual you just saw in the PowerPoint. But kind of the same idea. That glycol is going to be in the middle of the unit. Does that make sense?
Yes.
Okay.
Yes, good point. Yes. So yeah, you don't want to have to open it up every time that you want to take your reading. A lot of people do put those wires, and they lead those little wires outside so that they can actually see the screen and take the temperature. Yes, good point. I did not mention that. So the suggested, what is suggested from the CDC is that they would like everybody to start moving towards having digital data logger thermometers. So the digital data logger ones are the ones that take temperatures. You can set it so that every 5 minutes it'll take a temperature, every 30 minutes it'll take a temperature. You can set that. And so it's just a constant reading of what's going on in your fridge. So it gives you a lot of information, very accurate, very broad, and so you can see trends in your refrigerator as you go along, and so it can give you nice little charts that you can print off from your computer and just see what's been going on over the course of, months or weeks or whatever. That's what the CDC would like everybody to move towards. They are not required as of yet, but I would stay tuned with that one because that is the direction that we are headed at least. So at the moment, the ones that are allowed, if you do have a thermometer, if you do have a thermometer in your refrigerator and freezer, which you must, it needs to be ILAC or ISO 17025. It needs to have one of these two things. Both of them is a bonus. Both of them are great. But it needs to have at least one of these two things for it to be a valid certificate. And the reason for this is that they're moving towards a higher standard for getting those calibration certificates, and these two define that higher standard that they're going for pharmaceutical grade. And then also the calibration due should be listed on the certificate. And be sure that you update it before. If you see that you're going to need a new certificate of calibration, if it's going to expire, I would say even within the month, I would look into getting a new one quickly because you don't want there to be any time lapse. And sometimes with shipping and with getting everything in the mail, it can take a little while for you to get that new calibration certificate, and it can take a while for them to schedule you to take your thermometer and actually get it calibrated. So I would, long before the actual expiration date comes up, I would look into getting those redone. That way you don't have any lag time in between the expiration date and when you get it redone. And it needs to be at least every 2 years. And sometimes with the companies you can specify, a lot of times by default they will just do, whenever they calibrate it, it will be good for 1 year. But sometimes you can talk to them and have them calibrate it for 2 years. So I would look into that whenever you do get your calibrations done. Any questions on this here? Or anything that we've gone over?
Rhonda, are you going to talk about the backup thermometer?
Oh, yes. Yes, it is also recommended at the moment that you have, well, you need to have a backup thermometer. That is cut and dry. You need to have a backup thermometer. Also coming down the pike, you are going to need to have that backup thermometer calibrated as well to the same standard and the same parameters as your normal thermometer. And so you'll want to have that one just as a backup in case, so for example, if you do have that lag time in between getting this one calibrated and the date that it expires, you can have that backup thermometer take the place of it in the meantime. Or if something goes wrong with your thermometer, the batteries die, or it just goes kaput for some reason, you can have that backup thermometer and it will be certified up to the correct standard. So I would look into purchasing a backup thermometer with a current and accurate certificate of calibration. Any questions? All right. So whenever you give the actual vaccines themselves, there are several things that you will need to record each and every time you give a vaccine. And those are listed here. These are the things that you absolutely have to have. You have to have the vaccine name, the date it was given, the manufacturer, lot number, VIS publication date, and the date that you gave the VIS. So that can be served in a few different ways as long as somebody could clearly go in and verify that, yes, I gave that to them today, or yes, I gave that to them on this date. That will serve the purpose, but you need to make sure that you indicate somewhere in their record the date that you gave that VIS to them, to the patient. And usually it will be to date, but you need to specify that. And then you also need to have the clinic name and address, and that could be if you print it off. If you print off the patient vaccine record and it's listed on there, that is fine. If you are enrolled in the immunization system and your records are in there, then your clinic name and address will show up in there as well. You also need to have the vaccinator name and title, so the credentials of any nurses who are giving vaccines, if it's the doctor who's giving them, whoever is giving those vaccines, you need to have their credentials also included in that vaccine record. If you're doing paper records and they just initial where they put that, then they need to have somewhere on that page, they need to have their full name and their credentials and show that that is what those initials mean. So it's very important they have to have their full name and their title. And then also the VFC eligibility at the time of visit. So this is what we discussed there at the beginning, where each and every time they come in, you should be able to tell what their VFC eligibility was. Were they Medicaid this time, 2 times ago, they were uninsured, and et cetera. So you need to be able to retroactively go back and show what their VFC eligibility was on that day. Any questions on documentation that's needed? I know that there's a lot of different ways that some people do paper, some people have different electronic medical records, sometimes people exclusively use the IIS. So depending on the way that you are recording everything, your method of recording all of these might be different, but as long as they are all included for every vaccination given, then you should be compliant. So if anybody has any questions on your particular way of doing it, please feel free to ask. And if you think of something before the end, then we can cover those at the end. All right. A couple of other things on documentation. All VFC documentation must be maintained for a minimum of 6 years. So if you have a medical record system, then it will be in there. But if you have your paper records, you need to hold on to those for at least 6 years. And the vaccine dose is free for all of those VFC vaccines that you're getting. Any state vaccine is going to be free. However, you can charge for the administration fee. So for the physical act of poking them, you can charge for that. And the fee cap is $23.44. So if you are charging any more than $23.44 for non-Medicaid, non-privately insured kids, you need to be within this $23.44 for each one of those. And that can be for each vaccine given. And then also, you cannot deny administration because of inability to pay. So every child should be vaccinated at every opportunity, and do not ever deny anybody that. And then also, obviously, if you're in the VFC program, you will need to comply with all of the VFC program requirements and responsibilities. So that includes all of the documentation, all of the vaccine storage and handling, and all of the things that we're going over today. Because if you're part of the VFC program, they just ask that you follow the rules, basically. So ordering, receiving, and reporting. Be sure that every month, I know that you guys are familiar with doing your monthly reports. And I hope that you guys are excited about the online rollout. I'm very excited about that. But just be sure that you reconcile your inventory and do it accurately and appropriately. Account for anything that was wasted, anything that was transferred, all of that. You need to account for all of those and do that at least monthly. And then you can complete your monthly reports online now. And if you have any questions on that, please feel free to contact either me or Becky or Danette, and we would be happy to help you with those if you're having any trouble with those. And then be sure that you order by need. So it's not a good practice to hoard vaccines, to have more than you need, because if you hoard vaccines 1 year, if they do expire, it's a hassle to try to transfer them before they expire, and it costs a lot of money if you don't get around to transferring them or using them before they expire. And it's just not a good practice to take more vaccine than you need. Just try to order appropriately. Order for your needs for that month. And you're more than welcome to use the recommended order quantity. They have calculations in there that can kind of help you and tell you based on what you've ordered in the past what you would probably need this coming month. So that's very nice. And then be sure that you're within your timing and frequency. So if you're only supposed to order once a quarter, for example, then be sure that you get enough to last you through that quarter, and order during the right time. So the 1st to the 15th or the 15th to the 30th. And whenever you get the vaccine, whenever the FedEx guy brings them to you, you have them, verify that they're all there, verify that they're all correct and none of them are damaged. and then store them immediately. Don't leave them out for long periods of time. Take them out of their out of the packing box and put them in your refrigerator. And then you'll want to go right in and receive those into the immunization system as quickly as possible, because if people start pulling from those and actually using those vaccines before they're put into the immunization system, then they will not come out of your inventory if they're not there in the first place. So it just causes a little bit of headache towards the end of the month. So just be sure that you receive them in the immunization system as quickly as possible. And if there are any problems, notify Spokane Regional Health immediately. And you don't need to contact McKesson or DOH if there is an issue with your vaccine. Just contact Becky or Danette, and they can tell you what you should do from that point.
Hey, Rhonda. It's Becky.
Yes, ma'am.
You know how we have that tab that says Complete Monthly Reports online? Do you want to talk with them about where we're at in the process? Most of our providers have a growing awareness of the reconciliation submission, but not anything else. So if you want to talk about that for just a second, that'd be great.
Sure. So we're hoping by, based on the few meetings that I've been to, we're hoping that by December of this year, everybody will be on board and there will be no more need for paper reports. It will be all online except for your temperature logs. But you can do those online from now on. So there will be the reconciliation page that you can use to submit your monthly inventory. And then we're also rolling out to have the vaccine administered report where it breaks it down by age range. That one should be getting rolled out and in use here pretty soon, I would say within the next month or two. That should be fixed and ready to go. And we'll be conducting trainings with all of the local health, and we'll also be partnering with all of them to do trainings at all of the provider offices as well, or webinars, or whatever needs to be done to get everybody online and using it fully. So we're very excited about it. We're excited about saving all the papers that we would normally go through every month by sending those, and we're also excited to just have the whole process a little bit more streamlined than it was previously. Any questions on any of that? All right. So there are a few reasons why you would want to contact Spokane Regional Health. I know that we kind of scatter it throughout our trainings, and we kind of just scatter these. Well, if you have a problem with this, contact them. If you have a problem with this, contact them. Here's a list of if any of these things happen, you should call them. So if there's a temperature excursion, especially if it's more than a few minutes, definitely call them, and they will walk you through what to do. Any vaccine wastage, you'll need to fill out the proper forms for that, and then just call them and let them know if you have any questions, and they can answer those. Expired vaccine as well. If you have anything that is expired now and you need to send it back, then they can get you the proper mailing forms for that, and you can send those back to the manufacturer. And then also soon to expire lots. I know some people just have these lots that sit in their fridge, and then you don't do anything with them, and you just really hope that 50 patients will come in the next month and get these flu vaccines, but sometimes they won't. So if you do have a lot of vaccines that are going to expire soon, you can call Spokane Regional Health, and they will help you find out who needs some of those, and if there's an option for you to transfer those to somebody else who will actually use them before they expire. So that just helps to save money, and it's just a good practice to let them know. And then damaged or incomplete shipments, if anything comes in the mail and it's broken, or if you're missing something that you should be having, please call them for that as well, and just any general help or questions that you guys have. I know that they're very friendly and they always love hearing from you guys, so please call them if you have any questions. And this is their contact information here, if you don't already have it. And if you'd like more information on any of this, here's a couple of websites that you can go to. This is the Spokane Regional Health District website, and then this is just the general immunization system website here. So does anybody have any questions on any of this? I wanted to leave ample time towards the end for anybody, because I know a lot of times people will have various questions or different circumstances around vaccine storage and handling and documentation and all of these requirements. And it is very specific, and it covers a lot of different areas. So I know that everybody's situations are different. So if you have a question, please feel free to ask. That's what we're here for. So I'm just going to go ahead and open it up to either the chat box or
Rhonda, this is Ashley Barrett with Columbia Medical Associates. I was looking for my documentation, but of course I can't lay my hands on it. I have a question about the administration fee. I found an article, and it's a couple of years old. So I have a question about the administration fee relative to the new combination vaccines. Is the administration issued, I always thought of it as a per poke or per needle, or is it actually per vaccine?
That would be per poke.
Okay, so it is per poke.
Yes.
And then
So
if I found an article that said per vaccine, and that's what I can't lay my hands on right now. If I find that, can I send it to you to read, just to double check?
Sure.
Maybe I'm reading it wrong.
Yeah, send it to all of us if you could, if you find it. And
Okay.
it might have been just I mean, if it was just spoken of in passing, it might have just been a typograph that somebody didn't quite catch or that needed clarification. But yes, it is per, so it's the administration fee, right? So the physical act of giving somebody the vaccine.
That was, I always thought of it in terms of per poke, not what you're poking, just the fact that you're doing it. Okay.
Right.
Thank you.
Hey, Rhonda, it's Becky in the Health District. Can I jump in a little bit?
You bet.
Please do.
So one of the questions that has come up over and over is the different way that we code for that, like for billing, and that may be part of what Ashley is asking. So there's two different codes that we can use. The first one is code 90460. That is administration and counseling for the first antigen or a single antigen. Now, if you're giving a combination like a Pediarix or a Pentacil or a Kinrix or a Proquad, then you can also add 90461, and that is that additional vaccine or antigen that's in the vaccine. So just remember that for both of those codes, the 90460 or the 90461, what you're coding for is counseling by a physician or other qualified healthcare professional. And that's come up a couple of times. We definitely are charging a per poke fee. You can't charge per antigen if you're giving a multiple antigen in one shot, but you can charge for counseling for multiples, if that makes sense.
Becky, I think that's exactly what this article was, so thank you for clarifying that.
It's no problem. It keeps coming up, so I feel like we should all just have the conversation.
Exactly.
Thanks, Ashley.
Thank you.
Anybody else have any questions?
Oh, Rhonda, I should probably clarify that other side, because I was talking about how I just gave the codes that would be used for a physician or other qualified healthcare professional for face-to-face counseling prior to vaccine administration, but lots of times we have vaccine-only appointments where they just come in and see the vaccinator, so they see the nurse or the MA when they come in for their vaccine, and it's a different code, so I want to make sure and give you that code as well. So that code is 90471. So that's vaccines administered not with a physician doing face-to-face counseling or other qualified. 90471.
Okay, and then the other qualified, can that be a nurse like an RN, or does that have to be a physician or a mid-level provider?
Well,
for the counseling piece, do you know what other qualified healthcare professional means or is defined as?
I'm looking at my form here to see if it's further clarified under the immunization administration coding, and I don't see. I would like to say that registered nurse, yes, and anyone else, no, but I'm not going to say that because it isn't spelled out here for us. So I'd say we just stick with mid-level and physician. That's a good place to go. It's safe because they are billable, where an RN is not billable.
Okay.
Excellent discussion. Do you guys have any other questions? Do you guys need to get going? I see a few people are jumping off the call here. We can wrap it up here, or I have a couple other just optional slides on how to just best practices for the AFIX portion of the VST visits, if anybody has those or has an interest in those. I can go through those, or if you guys have more questions, then we would be happy to go over those. And we can go over the AFIX portion at a different time, too. Anybody have a preference? You can type it in the chat box. Okay. Well, since nobody's just chomping at the bit, I think that we could probably wrap it up unless Becky or Danette, do you think that I should go over the next portion, or what would you guys prefer?
I think that we could actually wait to do the AFIX portion, because one of the things that's becoming more and more important with AFIX is that we focus on just a couple of simple things that a provider office can do to improve their rates. So if we throw it in now and people are having to go because they have patients, then they won't hear it. But if we save it, then they can all learn about it maybe next time.
Perfect. That sounds good to me. All right. So in that case, that's all that I had for today. If there are any more questions, then feel free to ask. But if not, then I think everybody, thank you all for your time and have a great afternoon.
All right. Thanks very much.
Thanks, Rhonda.
Yeah, no problem.